Dear colleagues, dear friends, it's a great pleasure for me to be again with you, even in online format, for describing my thoughts about diabetes technologies and fasting and how they can help us to continue for our patient to live life without any complications of diabetes with high quality of life. My name is Evgenya Patrakeeva. I'm an expert in diabetes technology world for last 15 years doing research in this field. And I just want to say that it will be a lot of philosophical thoughts about technologies in diabetes, because of course, just 20 minutes is not enough to discuss everything around. But I hope that you will think about it after my lecture, and maybe if you will have any thoughts or questions or comments, you can just write me by email, which is written here, and we can do some research together, because for now, there is still not enough research in this field. Just start our discussion from the great issue. We need to understand that life-saving care is right, not a privilege, with all technologies in diabetes care which we have now. And you know that for now we have a lot of things to do in technology world, and just trying to imagine what does it mean to live life with diabetes. Of course, diabetes can be like a friend, like this horse here, with a very understandable feeling what we can do with diabetes, how we can prevent everything. And in a metaphorical way of thinking, of course, the perfect situation is like the situation on this picture. But of course, sometimes diabetes has another behavior, and sometimes something sudden may happen, and after this, life will be not so perfect, and diabetes can change everything in person with diabetes life. And if you try to understand what will happen sometime, like in case of this falling from the horse during Ramadan, of course, it also can change something in a patient's world with sleeping, with meal plans, with physical activity patterns, and reduction of vices such as smoking and medication adjustment. And we need to understand that all these things, even in lifestyle changes occurring when fasting during Ramadan, can change a lot of things around diabetes in patients' life. Why it's so important personally for me, because there is a lot of Muslim population in Russia, and especially in the south of the country, and we have a lot of work done in diabetes field here for now, fortunately, and also in technological things. And for now, we just have some reviews in scientific journal about technologies and diabetes during fasting. We have some regular social media posts for patients with diabetes about fasting for patients. We have a lecture in different regions with a great amount of Muslim population, because it's very important. I think that it's part of informational activity which we have to perform. And now we're preparing guide for nutrition during Ramadan for people with obesity, diabetes mellitus, different types, and other concomitant diseases. And I think that we can do these things also together, because for now, all things that technology can give us, like telemedicine and possibility to support any information from one language to another. So just I want to tell you that I will be more than happy to invite you to research in these fasting technologies, diabetes things. Of course, of all these changes can influence on diabetes compensation quality, but I think that here, before we start to discuss all technology things, I just want to remind you that there is a very useful things like risk calculation for patients with diabetes, because it's the easiest way to understand how we can help our patients with diabetes of any type, because here you can find in type 1 diabetes and type 2 diabetes, and of course we can recognize the risk score, and we have give the advice for the patient how we can help them. And I think that Ramadan for patients with diabetes again reminds us that education is the key, because every patient must know the risks, need to how to have glucose measurement, and here we will discuss later continuous glucose measuring, something about fluidary and dietary advice, of course about physical activity and exercise advice, when to stop the fast, and hypo and hyper recognition. And how do you think where technology can help in this key situation, even about only education? Of course, in almost everything. So just start our philosophical thought about technologies and diabetes during fasting. Almost everything can be in a better way with technology helping. Of course, we need to describe what a technologies in diabetes means. Sometimes it's a great mistake that we think that only there are technologies about blood glucose level measuring and insulin therapy, like CGM, flash glucose monitoring, smart pens, but insulin pumps, sensor augmented pump therapy, something about closed loop, artificial pancreas, something else. But there are also a lot of technology in another field, like mobile applications, social media, internet resources, big data things, reproductive technology, all diagnostic technologies, and this thing around it. And also very important things is a telemedicine system, which are very popular after COVID epidemic situation all over the world. So the main question here, how can all modern technologies can help our patients during fasting? And again, I just want to say that there are increasing recognition of use and technology of diabetes, all kinds of technology, not only about blood glucose measuring and insulin therapy, blood glucose monitoring, exercise time, medication dosages, energy injection can all be digitalized and assessed remotely. And that's the story about telemedicine. Pattern recognition and software is also available to help clinicians in complex decision. And again, especially for regions with a lot of kilometers, a great amount between patients and doctors, it can be very helpful. And remote technologies like text, emails, and video links can improve communication. And again, I just want to tell that everything can be very useful during fasting and Ramadan. Of course, what is the main risk during fasting for all of us clinicians who working with patients with diabetes? Of course, the story is about hypoglycemia, because is the most common concern for people with diabetes observing Ramadan fasting. And there are some studies showing increase in all forms of hypoglycemia on people with diabetes during Ramadan. So just want to remind you that, of course, life is an art of balance for our patients, because hypoglycemia is a major limiting factor, not only for type 1 diabetes patients, but type 2 diabetes patients. And there are a lot of causes, and I just modified some famous article from Crier. And of course, we know all these reasons, but also continuous fasting can be another reason for cause hypoglycemia. Why it's so important? Because there are a lot of information for now that even all things around pathophysiology and physiological changes around post-hypoglycemia situation are very important. And as you know from modern research, inflammatory proteins 7 days after hypo can be increasing and can influence on the situation in our bodies. So what is the only way to be sure about absence of hypoglycemia? Of course, it's continuous glucose monitoring. If you're still thinking that it's a story only for type 1 diabetes, you're mistaken, because for now we have some studies which are successfully saying that use of CGM in real time or flash monitoring in a patient with type 2 diabetes, even only on basal insulin, not on basal bolus therapy, can be very helpful in terms of decreasing amount of hypoglycemia, improving HbA1c level. Why we can use it not only during fasting, but always in type 2 diabetes, because patients can know their targets with CGM usage, learn how they respond to changes in nutrition, changes in physical activity, changes in medications, and can adjust their food choice. Again, also it's very important that knowing with telemedicine the information from CGM, we can go through time and range pattern and very easily recommend everything around dose changing and therapy changing for our patients. For example, here, if you can just view then some short time below range, not at goal, we can review or discuss stopping or starting some medication after meal. If you have something about above the range, it's also the issue you can use here. So just looking together how we can change patients' lives during fasting. Of course, we can help with continuous glucose monitoring and saying about the time and range concerns, and during telemedicine conferences or telemedicine visits from our patients to ask and discuss what we can change during insulin therapy or even non-insulin therapy for our patients. Again, here I just want to emphasize that telemedicine can be very helpful because, for example, we have this information with all glucose measurement, all time and range patterns. And it's example about one of my patients who were fasting for a long time, and with all things around glucose level and types of advice we can measure here and understand what's going on with diabetes in these patients. For now, of course, it's easier because we have, even for type 1 diabetes patient, we have some advices about basal insulin and prandial insulins. And of course, you can just write here, and I totally agree that sometimes we can just think about reducing the dosage of basal insulin, even on MDI, not only on the insulin pump, but also to change something about correction factor and sensitivity factor and some dosage. But also we need to understand that everything here about insulin therapy can be very individualized because we just need information about blood glucose, which is changing continuously. So here for this type of patients, for understanding the exact dose here with the decreasing of 20 or 30 or maybe 40 or 50%, we need information from continuous glucose monitoring, and this technology is a perfect way to understand what's going on. Of course, for now we have a recommendation for insulin pump therapy, and again, here we can just say that you can need to decrease this dosage of basal insulin, or sometimes you need to increase dose, but how we can confirm the right thoughts of the doctor's decisions during the Ramadan and fasting of patients on insulin pump? Of course, only with the continuous glucose monitoring. So please be very attentive to this thought that we need to remember about continuous glucose monitoring and insulin dosages during the fasting for patients who are using insulin pumps. So is it possible to use diabetes technologies during Ramadan? Yes, of course it's possible. And of course it's possible to use insulin pump, but only with help of CGM. It will be so useful for our patients as we dreamed before. And just here's a short explanation about necessity to remember about our adolescents going through fasting. For now, for recent guidelines from ISPAT, we have very tight thoughts about targets for patients who has diabetes in this age. So, of course, it's a difficult population, and we discussed it before, earlier in previous conferences. But even here, we need to thank diabetes technologies because with their help, we can even go through fasting during the holy months with adolescents with diabetes and with children with diabetes. There are a lot of thoughts about changing of insulin doses, and here again, I just want to remind you what you can think about insulin pump during patients with type 1 diabetes. But you don't need to think that insulin pump is the only possible way to treat type 1 diabetes. A lot of people with type 2 diabetes using now insulin pump. So just remember that it's not only a story about type 1 diabetes. How we can also understand that continuous glucose monitoring, even without insulin pump, is very, very, very useful during fasting. Again, it's a story about dairy, and we need to know information about changing in insulin doses and glucose level. And here, all devices which can be used during continuous glucose monitoring is very helpful in terms of dairy, because of this paper, I know that your patient also trying to do this like my patient, but sometimes you understand me, it's very difficult to find useful information in all this amount of paper trying to understand what's going on with diabetes level. So continuous glucose monitoring here is also very useful during fasting. And the last thing which I want to discuss you about technologies, it's a story about big data. Of course, for now, we understand that there are a lot of patients who fasted for a long time, and we need to have research here. And I just want to tell you that using big data, we need to collect them, will help us to understand a lot of things about fasting of diabetes. And again, I want to tell you that let's do something together here, because there are so many patients for whom it will be very useful. Only one story to say that, of course, a lot of advantages of technologies. For now, we discussed it, but of course, we are still only human, and there are still a lot of human factors in technology field, and sometimes fear of hypoglycemia, numeracy literacy, data overload, excessive time requirements, technology literacy, device incompatibility, and fear of new modern devices not can lead to this great advantage of technology usage for our patients. Just this thought, they're still not perfect, but we need to remember that we have to help our patients in a better way. So during fasting for now, we have new circumstances ask us for new decisions. Of course, education again, which is a main thing in diabetes, technologies including continuous glucose monitoring, healthcare service, and smart technologies are a part of our life now, not only continuous glucose monitoring, insulin pumps, but also telemedicine and all application and everything about big data. New devices are still coming, and we will have a lot of them in the nearest future. Of course, treatment of diabetes includes a lot of things with technology and new agents, oral agents, new insulin preparation, new analogs, and things around insulin injections. But the main thing is education. And we need to remember about the person behind all these numbers, and continuous education in all possible way during the usage of any technology in diabetes care is the only way to have success in this field. Why? Because of course, the main goal of all our things, all treatments, is not only target glucose level, no chronic complications, and no hypoglycemia, but also quality of life during all period of times, and during also fasting and Ramadan. Thank you for your attention, and please remember that I will be happy to answer your questions about technologies during fasting. Please, you can use this email. I will be more than happy to answer to your questions, and thank you for all your support.